showing the abnormal activity. So here, another reason that is abnormal cambium, which showing the abnormal activity. So these are the examples. So are accessory cambium, which arises from the cortex or pericycle. So here the abnormal cambium means, so the cambium which is developed other than the vascular regions. So the cambium which is forming from the other than the vascular region, it is called as the abnormal cambium or accessory cambium. The another name for this is the accessory cambium. Accessory cambium means nothing but the cambium which is developed other than the vascular tissue region, that is from the cortex region or pericycle. So it is called as the accessory cambium. So this cambial ring being placed abnormally functions in the abnormal manner. So here this cambium which is developing from the that is accessory cambium, that is it is developed from the cortex region or pericycle, and it is also behaves abnormally. Okay, it's not behaving the normal, the producing the secondary xylem and secondary phloem. So again here the formation of rings of vascular bundles which are embedded in the parenchymatous tissue. So here example is mirabilis stem. So the stem has a typical dicotyledonous structure. So that is extrastellar cambium which is originates from the cells of the inner cortex or the pericycle. Here in mirabilis stem, so here the formation of cambium which is developed from the inner cortex region. Okay, the cells of the inner cortex become meristematic and they behave behaves as a cambium. So it forms a secondary xylem and secondary phloem. A ring of conjoined collateral vascular bundle is thus formed and separated by the parenchymatous cells. So the first cambium which ceases its function after forming the ring of vascular bundles. So the cambium which is present, it will be ceases, it stops its function after forming these vascular bundles in the accessory region. So the successive be formed from the secondary parenchyma, and again it behaves in a manner similar to the first one. Okay, so the last cambial ring cuts off the sclerenchyma alternating with the secondary xylem and the inner side and secondary phloem and parenchyma on the outside. So here it producing the last cambial ring which is producing sclerenchyma and secondary xylem on the inner side and secondary phloem and parenchyma on the outer side. So generally a normal cambium which produces a secondary xylem towards inner side and secondary phloem towards outside. But here it producing the, along with the secondary xylem, it producing the sclerenchyma cells to the inner side, and outside it producing the secondary phloem and parenchyma on the outside. So it is also an abnormal activity. Hence the last ring of vascular bundles are embedded in lignified tissue. So like this, so first it produces the first the cambium which behaves normally and produces the secondary xylem and secondary phloem. But later, so after stopping this normal cambium function, after it ceases its function, so here the formation of accessory cambium will takes place from the inner cortex. So this inner cells, they behaves meristematically and behaves as the cambium, and it produces the secondary xylem and secondary phloem. So along with the secondary xylem, it produces a secondary xylem inside and secondary phloem outside. But the last cambial ring which cuts off sclerenchyma and secondary xylem towards inner side and secondary phloem and parenchyma on the outside, last cambial ring. So here's the last ring of vascular bundles are embedded in lignified tissue. So this is the another example of accessory cambium behaves abnormally. So that is a formation of rings of vascular bundles which are embedded in the conjunctive tissue. So here the cambial ring which originates in the conjunctive tissue and which gives off secondary xylem tissue on the inner side and secondary phloem tissue outside. So another one. So here what happens, so this cambial rings which is develops from the conjunctive tissue. Conjunctive tissue is nothing but between the vascular bundles, that is the parenchymatous cells are present, so they are called as a conjunctive tissue. In between the vascular bundles region, so the tissue which is this conjunctive tissue, it may be parenchymatous or sclerenchymatous. Okay, so the cambial ring which is originates in the conjunctive tissue and gives a secondary xylem tissue on the inner side and secondary phloem tissue outside. So the vascular bundles which appear to be embedded in the mass of conjunctive tissue. Example is here the bougainvillea and borrehavia. So here the example is bougainvillea stem. So here the first cambial ring is extrastellar in origin and which arise from the pericycle followed by the successive rings of cambia. So here the cambial ring which is developed from the extrastellar, that is other than the stellar region, outside the stellar region, that is from the pericycle here. So here the cambial ring which is developed from the pericycle region. So the cambial ring which cuts off secondary xylem, alternating the secondary parenchyma on the inner side and secondary phloem above the secondary xylem. So here this cambium which behaves abnormally means, so how abnormally means, so along with the secondary xylem which is producing the secondary parenchyma inner side, it's producing secondary xylem alternating with the secondary parenchyma towards inner side and secondary phloem to the outside. So the cells of the secondary parenchyma which are fusiform and more or less radially arranged and usually develop lignified thickened walls. So here it is referred as a conjunctive tissue or ground tissue. So here these secondary parenchyma cells, so it is called as a conjunctive tissue. So the successive rings of cambia are formed which behave in manner which is similar to the first ring as a result of concentric layers of vascular bundles which are formed embedded in the conjunctive tissue. So like this, so after the rings of cambia which behaves in the manner similar to the first ring. So this will continue after the production of this secondary tissue. It will stop its growth and another ring will be produced like this. So it will be continued. So the successive rings of cambia are which behave in the manner similar to the first ring, which result in the concentric layers which are armed of vascular bundles are formed embedded in the conjunctive tissue. So in some species of bougainvillea, this conjunctive tissue which consists of entirely sclerenchyma and cannot be demarcated from the xylem of the embedded vascular bundle. So generally conjunctive tissue it is made up of parenchyma or sclerenchyma, but in bougainvillea it is entirely sclerenchymatous. So here, hence the secondary phloem which is appear in the form of islands are isolated groups which are apparently surrounded by the conjunctive tissue. So when we observe, so this secondary phloem which appear as the islands which are embedded in the conjunctive tissue. Hence, it should not be mistaken as an included phloem. So this is a bougainvillea stem. So here outer epidermis, cortex, and endodermis, and phloem, and so this. So the vascular bundles which are present in the medulla region, they are called medullary bundles. So here this one is the conjunctive tissue. It is made up of sclerenchymatous cells. So in between these vascular bundles, so these are the vascular bundles. In between this, the tissue which is called as a conjunctive tissue, which is made up of sclerenchyma. So here this one, so it is producing this cambium. This cambium which producing phloem outside and here secondary xylem and conjunctive tissue towards inner side. So this cambium secondary, it producing the secondary phloem towards, so this cambium which producing secondary phloem towards outside and here it producing conjunctive tissue, that is the producing the secondary vascular, secondary parenchymatous cells are sclerenchymatous cells and secondary xylem towards inner side. So due to which what happens? So these phloem which is embedded in the so these are the regrowth which occur in the bougainvillea.
Madam, your voice. Madam. Hello?
Sir,
Your
sir,
voice is resound. Your voice has not clearly audible. Hello? Madam, am I audible?
sir, is it okay now?
Right.
Yes, sir.
Proceed, madam.
Sir, now is it okay? So next one is the anomalous secondary growth in Borrelia. So the